My name's Claire Rogers and I'm the Tissue Viability Lead for West Herts Community NHS Trust. And our poster presentation is entitled Targeting Speedier Healing and Pain Reduction for Category 4 Pressure Ulcers Using Axel Hill Solo. Patients with pressure ulcers experience a decline in well-being and social functioning, an increased risk of infection with an increased risk of sepsis and death. Management of pressure ulcers continue to pose huge challenges for healthcare professionals globally, with an associated economic burden. Pressure ulcers invariably take a long time to heal, with Category 3 and 4 pressure ulcers and unstageable ulcers taking a mean time of 7 to 10 months. Only 21% of Category 4 pressure ulcers are resolved within 12 months. New ways of progressing these chronic wounds are essential to reduce the burden for patients and the health burden. A case series was undertaken to determine the health benefits of applying Axel Hill Solo as an adjunct to standard care for patients with chronic Category 4 pressure ulcers. 3 patients with non-healing Category 4 pressure ulcers were included in this study. Holistic assessment was undertaken prior to, during and following the therapy. Patient A was a lovely lady who had a Category 4 pressure ulcer to her coccyx. She had chemotherapy which delayed wound healing. Wound dimensions prior to Axel Hill Solo were 36 cubic centimetres, with undermining at 5 points between 2 to 6 centimetres in depth. Bone was palpable at 12 p.m. Following the 12-day Axel Hill Solo therapy, there was a significant reduction to the undermining area. 28 days following the commencement of Axel Hill Solo, the wound reduced by 79%, with only one area of undermining tissue remaining. On review, at day 35, there was a 94% reduction in wound size. The second Axel Hill Solo was commenced with the aim to heal the wound as soon as possible in order for her to recommence her chemotherapy. The wound healed at 85 days following the commencement of the first Axel Hill Solo therapy. She found the device to be extremely comfortable, easy to wear, and was absolutely delighted with the progress that the wound had made. Patient B, our second patient, resided in a care home and presented with a non-healing Category 4 pressure ulcer, present for 4 months. He was treated for osteomyelitis and has significant pain score of 8.5. He was taking cocodamol regularly, but really this wasn't managing the pain adequately enough. Axel Hill Solo was commenced to reduce the pain and kickstart wound healing. Wound dimensions prior to Axel Hill Solo were 9.2 centimetres cubed, with undermining tissue. Pain score was reduced to 0, which was a 100% reduction within 12 days of using Axel Hill Solo. 21 days following the commencement of Axel Hill, the wound size had reduced by 48%. 56 days following the commencement of Axel Hill Solo, the wound had reduced by 94%. The patient was then discharged from our service, and the nursing home staff reported that the wound had healed. This had hugely improved his quality of life and mobility due to the healing and the pain reduction. Patient C was our third patient, and he had a recurrent Category 4 pressure ulcer, sacral pressure ulcer, which was present for 5 years. He had developed and was treated for a local abscess in May with no presence of osteomyelitis. He didn't have any pain. We started Axel Hill Solo to kickstart wound healing. Wound dimensions for this wound was 4.5 centimetre cubed, with multiple areas of undermining tissue, and was 4 centimetres in depth. Bone was palpable. Following the 12-day therapy, the wound measured 5.6 centimetre cubed, which was a slight increase. However, the undermining tissue had reduced to a maximum of 3.5 centimetres, with one area completely healing. Within 19 days of commencement of Axel Hill Solo, the wound measured 4.9 centimetres cubed and decreased by 12% in 7 days. the undermining tissue has reduced to a maximum of 3 centimetres within several areas. A second Axel Hill solo was commenced towards the beginning of October, and I've personally just reviewed him, and the wound has significantly reduced in all dimensions, and the patient is absolutely delighted with this outcome. In conclusion, Axel Hill Solo has been shown to reduce pain and kickstart the healing process for recalcitrant Category 4 pressure ulcers, which were previously unresponsive to standard care alone, allowing patients to regain their lives.